I'm going to begin by reviewing the prescription. So, hi, my name is Isabel Shell. I'll be your student nurse for today. I'll be inserting a urinary catheter. It will involve a little bit of touching. Is that okay with you? Patient says yes. So, can you please tell me your name and your date of birth, please? So, using two identifiers, I've identified my patient. Next, I'll begin by closing the curtains to ensure privacy. I'm going to assess my patient. So, do you have any pain, any discomfort? No. Okay, great. Also, do you have any allergies, for example, to latex? No. So patient states they have no allergies and no pain. Next, what I'm going to begin by doing is I'm going to place my patient in a torso recumbent position with hips externally rotated. I'm going to place a drape on the abdomen and the legs to ensure that I'm only exposing the perineum area. Next, what I'm going to do is I'm going to lower the bed rails and position the bed at a good working height. So once I've done that, I'm going to begin by opening up my drainage system and my urinary catheter. And I'm going to begin by opening up my catheter kit. So this is my transferring forceps, touching my 1-inch border to keep sterility. Once I've done that, I'm going to begin by setting up and preparing my environment. So placing my drapes here, my sterile gloves, my cotton balls, my lubricant, my syringe, and my forceps for cleansing. So once I've done that, I'm going to begin by taking betadine and pouring it over my cotton balls. I'm also going to begin by taking my catheter and placing it into the kit. I'm going to take my syringe as well, place it in here. So once I've done that, I can begin by putting on my sterile gloves. So once I've put on my sterile gloves, what I'm going to begin by doing is I'm going to begin by placing the drape under my patient's thighs. And I can touch the drape because my gloves are sterile. So I'm going to do it like this, placing it under the thighs, ensuring that I'm only touching my 1-inch border. Next, I'm going to begin by taking my blue drape and placing it over the perineum area, like this. So once I have done that, I'm going to begin by lubricating my catheter. So I'm going to open my lubricant. I'm going to place it on the side here. I'm going to begin by opening up my catheter. I'm going to begin by lubricating the catheter with the proper amount, as well as attaching my inflation syringe to the inflation cord. So I'm preparing my environment basically. I'm also going to place my forceps in here. So once I've done that, I'm going to take my kit and place it on the drape, which is sterile, right? This. So let's pretend I'm at the bedside. So I'm going to begin by cleansing the perineum area. So I'm going to take my non-dominant hand, place it on the labia, and open the labial folds. I'm going to begin by cleansing the clitoris to the anus with a one-way stroke, starting with the labial folds and moving to the urethra with my cotton balls with betadine. So one-way stroke on the labia, one-way stroke on the other labia, and then one-way stroke on the urethra. So once I have done that, I can place my forceps here. I can begin by taking my catheter and inserting about 5 to 7 centimeters into the urethra until I see urine. So once I see urine, I'm going to place an additional 2.5 to 5 centimeters. Once I've done that, I'm going to release the labia with my non-dominant hand and place my non-dominant hand on the catheter as I'm going to begin by inflating the balloon at about 5 cc's. So once I've inflated the balloon, I'm going to pull a bit to see for resistance to see that the balloon has been properly inflated. I'm going to begin by releasing the inflation syringe. And I'm going to take my drainage system and insert it into the catheter. Next, what I'm going to do is I'm going to place my drainage system, let's say, over the bed, and I'm going to place it below the bladder level, and I'm going to ask my patient if they're in a comfortable position. I'm going to lower the bed and raise the bed rails, and I'm going to begin by disposing all of my material. Placing it in here. This goes into the sharp containers. So let's say I put it into the sharps containers. So once I've done that, I'm going to take my sterile gloves. I'm going to dispose all of this and perform hand hygiene. So for documentation, inserted indwelling Foley catheter number 14 as per doctor's order, inflated the balloon with a syringe at 5 cc's. Drainage had no odor, straw-colored urine was clear. Patient tolerated the procedure very well, and I'll keep monitoring.